My next guest, Planned Parenthood's President Cecile Richards, endured a real grilling on Capitol Hill this week. Ms. Richards, welcome back to Meet the Press.
Good to
Obviously,
see you, Chuck.
We went through a lot of the federal funding issues. Let me just simply get you to react to what Carly Fiorina said last week on this show.
That scene absolutely does exist, and that voice saying what I said they were saying, we're going to keep it alive to harvest its brain, exists as well. Planned Parenthood is aborting fetuses alive to harvest their brains and other body parts. That is a fact.
Ms. Richards, how do you respond to Ms. Fiorina?
It is extraordinary that someone running for president would lie in that way. This has been completely discredited by every reputable news source, and yet Carly Fiorina seems to continue to repeat the same lie. I think it also shows how using distorted and deceptive videos as the ones that have been used against Planned Parenthood, they're not credible, and it's not a basis upon which to make decisions about an organization or public policy.
Do you have any second thoughts about Planned Parenthood donating this fetal tissue? Do you have any?
Look, fetal tissue donation was actually started after a bipartisan commission of the Reagan administration outlined how fetal tissue donation and research could happen, and it's actually, led to all kinds of important medical research.
There's a lot of questions, though, that it's really not necessary, and that the amount of fetal tissue that Planned Parenthood is donating is probably unnecessary. So why not just stop it?
It is a very small part, and we talked about this week at this hearing. 1% of our health centers actually allow women to donate fetal tissue for medical research.
Why not make it 0%?
Well, it's interesting. One, because I do think the research is important, and many bioethicists and medical researchers have said that.
So you're not going to ban this practice?
We have women, ironically, Chuck, actually, after all of this has come out, we have many women voluntarily asking, saying, I'd like to make a fetal tissue donation. So again, it's not a large part at all, 1% of our health centers, but I do think it's an important part of medical research, and these women who make these voluntary decisions to donate fetal tissue should not be shamed for doing it.
Then why be even a go-between financially? Why not just make it a full-fledged donation and not take any money?
Well, and that's what's happening in Washington State. And
no more money is going to exchange.
They take no reimbursement for it. And again, it's all reimbursement for costs as it's legal under the law. And we're looking at all of our, now as a result of all this, we're looking at all of our guidelines around fetal tissue research and donation, and we'll be doing anything we can to improve those standards. But I think, if you sort of step back, I think all of this, and certainly this hearing this week, it's not about fetal tissue research. It's about whether, frankly, abortion is going to be safe and legal for women in the United States of America.
One of the questions you were asked, arguably you didn't get a chance to answer it, is what were you apologizing for? Why did you apologize after the first round of videotapes came out? And what were you apologizing for?
Well, first, let me just say, since that first tape came out, again, this is a group that undercover videotaped for 3 years in our health centers. When it first came out, what I said in my response was that I apologize for the tone, and I think that the sense that this was a non-clinical setting in which clinical discussions were happening in a non-confidential manner, and that didn't reflect, I think, the compassionate care that our doctors and clinicians provide to 2.7 million patients.
Why didn't you relieve her of her work?
She's an excellent doctor, and I think that making decisions on medicine, on healthcare, based on highly sensationalized and now fully discredited videotapes it's not good practice. And I think that I would really encourage anyone, member of Congress, you, to come and visit a Planned Parenthood Health Center if you really want to understand the care that Planned Parenthood provides to so many people in this country.
Another issue that was brought up a lot during the hearing was Planned Parenthood's political activities. And it is notable you're not a women's health specialist, and you replaced somebody who was head of Planned Parenthood who basically came from the world of health care. You came from the world of politics. And in 2008, you were quoted as saying, when you wanted to ramp up Planned Parenthood's political activities, you said, quote, "The largest kick-butt political organization is what you were going to grow." Do you think maybe that Planned Parenthood should get out of politics?
Well, when I think of politics, I think of advocating for the women that we serve, and that's essentially what we do. And so the Planned Parenthood Action Fund does advocate, and it's never been more important. We are seeing record number of laws being passed in the states, being introduced in Congress to limit
NARAL and
women's
Emily's
access.
list exists. There is other places that fight for women's health care rights.
I can tell
out
you,
there.
I come from the state of Texas, Chuck, where they have passed more laws in the state of Texas to reduce women's access, and not just to safe and legal abortion, to family planning, to breast cancer screenings. And then there's been no more important organization in the state of Texas that is mobilizing folks like Dana, who I talked about in my testimony, who literally her life was saved at Planned Parenthood because we did early detection of breast cancer. She got treatment and she's now cancer-free. She's a strong advocate, not for Planned Parenthood, but for the women who depend on us for health care.
But if you thought it would save Planned Parenthood's status with the federal government, would you take Planned Parenthood out of political activities?
Well, it's important to understand Planned Parenthood is a healthcare provider. The Planned Parenthood Action Fund does advocacy. And I absolutely don't believe that. In fact, I feel like we are on the front lines in states all across the country and in the federal government in advocating for women's health, and we need to be. I'm really proud of the fact under the Affordable Care Act now, we have for the first time, and Planned Parenthood was really in the lead on this, women don't have to pay more for health insurance than men. We can cover our kids till they're 27 years old, like I did with my 3 kids. And now, for the first time, women can't be denied health care coverage because they have a pre-existing condition. That's what our advocacy is about. It is about moving the...
There are some supporters you've alienated. Republican Senator Susan Collins, somebody Planned Parenthood endorsed when she first ran for Senate. She is somebody that has fought to keep Planned Parenthood
and I consider
funding.
her a good friend.
And then you were upset with one, the organization, I think it was before you were there, was upset with a vote she made on one Supreme Court justice. And she feels as if almost it became too politicized. It's too much of an arm of one party.
Well, believe me, and I have a strong relationship with Senator Collins, and I think she would say the same. We do support Republicans, and believe me, as I said in Congress, I would love to have more Republicans support women's health and women's rights. What's disturbing to me is that, in fact, the leadership in the Republican Party, not Republicans, we have Republican board members, patients, employees, and they're very disturbed to see that the Republican Party leadership, not the party, has abandoned mainstream moderate Republicans. This is the most fundamental Republican issue, is less government interference. So how could the Republican Party be the one that actually wants to take away the right of women to make their own choices about their health care and about where they go to get it?
Do you believe, though, you would be a target if you weren't as active of a participant in campaigns as you are?
I believe if we were not as active as an advocacy organization for women and women's health, women in this country would have fewer rights than they do today, and we can't let that happen.
All right, Cecile Richards, President of Planned Parenthood. I'll have to leave it there.
Okay, good to see you.
Thanks for coming on.
Thanks.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and then click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.